everyone. My name is Diana Powell. I've just completed my Master of Social Work degree, and I'll be co-presenting with Bobby Younce, a second-year doctoral student in the College of Social Work. Today, we will be reviewing results from a survey and focus group and conceptualizing a new model to address gender-based violence by moving from a bystander to an upstander intervention. First, we want to provide some context for structural violence. Structural violence is a concept for a form of violence wherein some social structure or institution may harm people by preventing them from meeting their basic needs. Today, we're narrowing it down to focus on the infectious disease model, with the primary focus on interrupting transmission and spread. So to differentiate, you are probably familiar with a bystander, someone who witnesses an incident of gender-based violence and does not intervene. Our model proposes moving towards an upstander approach, someone who witnesses the same incident but takes action to interrupt.
So next, we wanted to go over the preliminary results from a university-wide survey that we conducted to assess how sexual and gender minority women experience gender-based violence at the university level. Here you'll see that we had 211 participants. Of those, 116 identified as heterosexual, while 53 identified as bisexual. Unfortunately, we only had 7 identify as gay or lesbian and 3 identify as pansexual. Therefore, our findings really only speak to how participants who identify as either heterosexual or bisexual experience gender-based violence at the university level. So here we've provided the top 3 types of unwanted sexual contact that participants experienced in the last 12 months. We'll see that those were sexual advances, comments, and jokes, followed by being shown or sent sexual pictures, photos, or videos that were unwanted, and then being pressured to have sexual contact after saying no. We can see with these rates that participants who identified as bisexual experienced all 3 types of unwanted sexual contact at higher rates compared to their heterosexual counterparts. Also, it's worth noting that overall in our survey, that participants who identified as bisexual experienced all forms of unwanted sexual contact that we assess for at higher rates compared to their heterosexual counterparts as well. Next, regarding themes from the student focus groups that we held, we found that there were a lack of resources for those who experienced technological forms of gender-based violence. Also, sexual and gender minority women are more vulnerable to gender-based violence. We also found that there was uncertainty regarding how to prevent gender-based violence against other women. And then finally, we found that participants thought there needed to be an ongoing discussion of gender-based violence on the campus, as opposed to just whenever an incident would occur. So our proposed upstander model to address gender-based violence is based off of the Cure Violence model. Dr. Slitkin developed this infectious disease model after realizing that gun violence spreads similarly to infectious disease, and that if the spread could be disrupted, the overall violence could be decreased. So application of this model to gun violence has actually achieved a 41 to a 73% decrease in shooting and killings in the United States as well as globally. The Cure Violence is an upstander model since it primarily focuses on identifying people in the community and training them to be upstanders, which will then lead to a shift in norms. So we propose that we would use the Cure Violence action steps to address gender-based violence. Step 1 would be to detect and find, which is where the upstander in the community acts to interrupt transmission of gender-based violence perpetration at the source, ideally before perpetration has occurred. Step 2 would be to prevent future spread, which is where the upstander prevents those exposed to gender-based violence from continuing the spread of violence. And then step 3 would be to shift norms, which is where the upstander may change norms through community engagement, community organizing, as well as training. We wanted to thank you very much for the opportunity to present today and say that we're looking forward to answering questions at the Q&A portion of today's symposium. Thank you.